but we'll try to explore with chalk and blackboard. Okay? Any problems? Green board. Okay, chalo, green board. So any problems in between, you can always ask me. The last remedy we spoke was Sina. Aditi, any doubts in Sina? Okay. Sina and the other remedy we spoke was Dulcamara. I hope both the remedies are clear. Okay. See, we'll continue with another remedy which has something similar. Okay. Because we have started with Dulc and then we shifted to Sina. Now, my question is, which are the remedies which predominantly acts on joints? Very good. Restox. Bryonia, good. Arnica. Ruta, yes. Symphytum. Ledum, good. Okay, Lycopodium. Then Calcarea first, very good. Dulcamara, that's what I wanted. Like, okay, chalo. We also had Dulcamara, we had Calcarea first, absolutely right. Now, when Calcarea first in joint affections? Well, generally we talk of Calcarea first for deficiency. Now, when do we use Calcarea first in joint affections? Ligament tear, more than ligament tear. See, like you have got a very characteristic ailment. What? Yeah, see, open fontanelles, they're all there in Calcarea first. Not that I'm against all those things. But when in rheumatism, in joint affections, you think of Calcarea first. See, Calcarea first, mainly when joint complaints come during cold weather. Cold weather alli joint affections. So, joint affections which gets aggravated in cold weather. If you have that situation, that's where we use Calcarea first. Okay? See, Bray, Restox, I know, from first year of yours till you finish, we only think of Bray, Restox. But once you start practicing, you should realize there are many more remedies which mainly acts on joints. Dulcamara, yes. When Dulcamara? Exposure to damp weather. Okay, Dulcamara, good. Then, few more unusual remedies that came up was Symphytum. See, Symphytum again, if you go back to the sphere of action, which part does Symphytum act? Bones. It is a remedy which predominantly acts on bones. Okay, my question was remedies acting on joints. Better, fast. Somebody also said Ledum. Somebody said Ledum. Yes or no? Yeah. Now what do you have in Ledum? What do you have in Ledum? In Ledum you don't have joint affections. Okay, there is rheumatism, good. Okay, there is stiffness. Okay, stiffness better by putting leg or keeping leg in ice cold water is Ledum, very good. Okay. So we'll try to explore a little more about Ledum. So in this next 45 minutes, we'll try to understand for what affections Ledum is predominantly indicated and what happens in Ledum. Okay. So as I try to tell you, Ledum is one remedy or one of those remedies which has predominant action on joints. Okay. And this is a remedy which mainly affects the fibrous tissue. Now what is fibrous tissue? Fibrous tissue. Okay, it's a type of connective tissue. Good. Okay. So Ledum has got an affinity, or in the sphere of action, you see Ledum mainly acting on the fibrous tissue, the connective tissue, and of course you also see this remedy mainly acting on joints. Okay. Now what is the next question that will come up is which type of joints? So from your anatomy knowledge, is it large or is it small? Okay. So this particular remedy has main affection for small joints. As a second year student, what conditions will come to your mind when we talk of affection of small joints? Huh? No, my question is, what conditions come to your mind when we talk of affection of small joints? Very good, I heard it right. Another? Gout, correct. And that's what you also see that, Ledum is again a top remedy for gout. It's a top remedy for gout. Okay. So, if you just go back and if you see where was Ledum used in olden days, you got a beautiful history. It is called marsh tea. Fine. And it was used to keep away lice, and it was used to keep away small worms, insects in rice and all those things. Okay. It's got a very strong odor. Fine. And this odor is what helps in keeping these small worms, insects away. Okay. So, but homeopathically, we don't use Ledum for worms, or we don't use Ledum for lice and to shoo away insects. We have got better indications of Ledum, and in that what we see is Ledum has main affinity for joints, and joints again for small joints. Okay. We'll try to take up the action of Ledum on joints, and then we'll move further. Okay. So which joints is what we saw? It mainly affects the small joints. And it mainly causes inflammation, and it also causes a condition, what we call it as gout. Okay. Now, as a second year student, what do you understand by gout? Very good. It's a metabolic disorder. It is a metabolic disorder, and they will have problems in uric acid metabolism. Very good. Which is the main joint that gets affected in gout? Knee. We are talking of small joints. Knee will not come under small joints. So tomorrow in your clinic you have a person who comes to you with pain, swelling in great toe. Okay. One probable diagnosis of yours should be gout. And as a homeopath, one remedy that should come to your mind. And I'll also give you the indications. When do you think of Ledum in gout? Okay. So before we are getting into the remedy, few things are very clear for you. What is that? We are talking of a remedy called Ledum, and Ledum is a remedy which predominantly acts on joints, that too small joints. And acting on small joints, it mainly causes gout, inflammation, okay, and it also causes that gouty deposition in the joints. So it's a remedy for gout. Okay. What other remedies come to your mind? Very good. See, you need to be loud. Absolutely right. Who has said? Correct. Yen helidre? Very good. You heard it? Colchicum autumnal. Okay. Again, one of the top remedies for gout. Good. Any other remedy other than colchicum? How is it in colchicum, the joint affections? How is it in colchicum? Colchicum is over or no? Yes. Very good. How is it in colchicum? Huh? Not over. After a lot of discussion, I thought you are discussing about the symptoms. And after a lot of discussion, you have come to a conclusion. Colchicum is not over. Okay, chalo. Colchicum is not. Yeah, it's over. See now what happens in colchicum. Colchicum you generally have, not necessarily in gout, but generally in joint affections, colchicum will have shifting pains. Pains which keep moving from one joint to another joint. That flying pains. Okay? That shifting pains are very special of colchicum. And colchicum joint complaints are better by profuse urination. Okay? Done? After they pass urine, and especially like you give a remedy, and if the person is indicated with colchicum, and after you give colchicum, generally they tend to pass little sedimentous urine. What does this suggest? Uric acid. Fine. kidneys, whatever metabolic imbalance was there, that has been taken care. Okay, we'll come back to Ledum, but I personally feel as a second year student, you should know at least the minimum difference, if not the minute difference. Okay, so colchicum was another remedy. We spoke for gout. You got a lot of other remedies. When arnica? When arnica? We are talking of gout, or we are talking of joint affections. When arnica in joint affections? Huh? See, we all know arnica is a beautiful remedy for injuries. But it's not necessary that, anything that we ask in arnica, you bring in injuries. Why typhoid in arnica? Injuries. No, for everything, you have to think. Why? I mean, what is so special, or what is that indicating point in arnica when it comes to joint affections? They will not allow you to touch aggravation. Gout, joint affections, but they will not allow you to touch. And that is one reason why arnica, even when the arnica patient is sick, what will the arnica patient tell? More than not wanting doctor, what will arnica patient tell? I am fine, I am okay. He might be having 103 or 104 degree fever. In spite of that, what will arnica tell? No, I am fine, I am okay. I don't need doctor, I don't need treatment. Okay. Now one reason why arnica avoids is because he's got bad fear. And what is that fear arnica has? Fear of being touched. See, naturally you are a doctor, when they come, what will you do? You examine, you touch, fine. You want to examine the joints and do all those things, which arnica will not like. So what will he decide mentally? I am fine. Only if I am sick, you will trouble me, no? So he will not say he is sick. Fine. So that is arnica. Arnica touch aggravation. Okay. So arnica we were also discussing a little about colchicum. We will come back to Ledum. So in Ledum, mainly acts on joints, and it will cause rheumatism, and predominantly it's got a special affinity for small joints. Like, for example, you can see metacarpal, metatarsal, or the great toe, the wrist getting affected. Now what will this particular remedy do acting on joints is, it will cause inflammation. So very bad pains, unbearable pains, okay, tearing, sharp stitching pains. This is a character of pain. How was it in arnica? Arnica has got sore, sore, bruised pain, as if bitten. When there is a bruise, what type of pain you have, that type of pain is what you have in arnica. Sore, bruised pain is what you have in arnica. Okay? So Ledum will have more of sharp tearing pains. And the rheumatism in Ledum. Okay. Now what you typically see in Ledum is joint affections mainly starts in the, observed right, mainly starts in the great toe, ankle, knee, hip, and you see this going up. So this is what we call it as ascending type of rheumatism. Am I clear? So Ledum will have ascending type of rheumatism. So it starts lower down and it goes up. Okay. Exactly opposite is, at least tell me the opposite of ascending. Very good. The remedy which has got descending type is calmia. In what happens in calmia? Complaint starts in shoulder, it will go down to the elbow, wrist, and lower down. So opposite is calmia, which will have descending, and Ledum is a remedy which has got more of ascending. So what did you understand? It's affinity for joints, affinity for small joints. It can cause inflammation, it can cause gout, and I told you about the type of pain, and then the ascending rheumatism. Okay. One more characteristic symptom you have in Ledum is diagonal affections. Okay. Now what do you understand by diagonal? Fine. For example, in Ledum, you have left shoulder and right hip. This is diagonal. Okay. Left shoulder and right hip getting affected. So diagonal affections. Other remedies? Agaricus. Heard about agaricus? Restox. And if it is right shoulder and left hip, the remedies can be plenty, but one remedy is ambragracia. Heard of ambragracia? No. Okay, don't worry. Somebody will talk in future. So right shoulder, left wrist, left hip is ambragracia. Many other remedies. And we are talking of ledum. And how is it in ledum? Left shoulder and right hip. So this is what we call it as diagonal affections. Crosswise. Okay? Fine? You getting an idea? Fine. So this is with the joint affections. And somebody rightly said when we started ledum, the joint affections in ledum, that stiffness, that pains, generally they are better by cold application. So keeping their leg or keeping the affected part in cold water, soaking it in cold water, that will give them lot of relief. Okay, that will give them lot of relief. Fine. So joint affections, which generally they ask for 5 marks in your exams. So what did you understand under joints? Very good. Small joints, ascending type, and it can also have diagonal affections. Very good. Better by cold. Yes, better by cold application. Character of pain, it's also a remedy for gout. Tearing, stitching pains. Yes, good. What else? We spoke of ascending. Okay, good. Ascending type. See, another area that you have to remember in ledum is about injuries. We spoke of joints. Now we are trying to concentrate on injuries. Now what comes to your mind when we talk of injuries? Now tell me whatever you are trying to tell me. A little while. Very good. Arnica. Calendula. Good. Bellis. Very good. Good. Hypericum. These are all there in your syllabus, no? Bellis is there. Hypericum is there. Any other remedies? Okay, from whatever you are trying to tell me, what happens in arnica? Mechanical injuries, blunt, contusions, bruises, blow. Very good. And with that, sore pain. Head injuries, okay, road traffic accidents. And what will arnica do? What will arnica do? Louder. Arnica has got a capacity to absorb clots. We have discussed this. It acts on the venous capillaries, arnica, arnisin, the alkaloid, and it tends to absorb. If not big, yeah, it absorbs clot. Okay. So mechanical injuries and that blunt, bruises, that's where we think of arnica. Very good. Then bellis. How is it in bellis? Louder. Very good. Yes. See, that is the key word in bellis. It mainly affects the soft part. Now what do you understand by soft part? Muscles. Okay, good. Then pelvic organs. Something more clear. Uterus. Okay. See, bellis is a remedy when, especially we think bellis in post-operative conditions. What is it? Post-operative conditions. When there is a deep injury to the, or after surgery, fine, when there is a deep injury to the muscles, all those things, like for example pelvic organs or abdominal organs, there, injury to deeper organs, deeper muscles, soft structures, we think of bellis. Okay. Bellis, I'll try to tell what my sir had taught me. Bellis, what is bellis? Bellis is a plant. For example, you stamp and you take your foot back. What will happen to it? It again comes up. You getting my point? You stamp, it will not, it's not over. After you lift your leg, it will come up. So what my sir says is, people after a shock or after some blow, and again they come back with a bang. You are following what I am trying to tell you? You are getting my point? So like for example, even after going into some kind of a failure or some kind of a shock, there are people who come out with a bang. They come out more successful. They are the people who require bellies. Am I clear, or should I repeat?
Yes.
Clear? Fine. So they are the people who require more of bellies. But for you, for a second year student, a remedy which affects deeper structures, okay, soft structures, especially after post-operative conditions, surgical conditions, we think of bellies. Somebody was using the word calendula. Calendula? When calendula? Lacerated injuries. And what will calendula do? It shrinks. What will it shrink? What will calendula do? See, as a homeopath, I've been insisting, when you read materia medica or when you read a drug, you should try to reason it out. You should try to understand. Now, if calendula is given, what will calendula do? You said something. Very good. How will it promote healing? Good, correct. I got nothing against your friend. It promotes healing. How will calendula promote healing? There are allopathic hospitals where they use calendula mother tincture, okay, as an external applicant. It hastens. What does it hasten? It hastens formation of granulation tissue. Okay? Granulation tissue, as a pathology student, that's what I am trying to tell you. You should correlate materia, pathology, forensic, ella. Then it's fun. So it will help in promoting granulation tissue. Okay? That is calendula. Ruta. You're talking of ruta. Somebody was also trying to tell me about symphytum. How is it in symphytum? Injuries, what? In symphytum? Injuries, mainly bones. Skeletal injuries. Fractures. And what will symphytum do when you give a symphytum in fractures? What? This will have a lot of meaning. Fine. What will symphytum do? It will increase formation of callus. Like you are trying to tell me about calendula. See, now in fractures we don't give calendula. You are getting my point? There we don't need granulation tissue. There we need callus. So there we give remedies like symphytum, remedies like ruta, remedies like calcarea first. Okay? They improve callus formation. Am I clear? We spoke of arnica, we spoke of calendula, bellis, symphytum, ruta. There are plenty of remedies for injuries. Another remedy is for example, with blade, with knife. What is this called? Yeah, it is sharp, agreed. Clean cut. Surgical, very good. Yeah, with scalpel, what they do, no? We call this as incised wounds. And the remedies? Jorage. Very good, absolutely. Staphylococcus aureus. Staphylococcus aureus is the remedy for clean cut injuries. Okay? There are people, no? Will you marry me? No. Fine. I mean, they take it can be threatening or it can be real. They just cut. So this is what we call it as incised injuries. And homeopathically, one top remedy is Staphylococcus aureus. Why I am trying to give you examples is because first class what you told me? Sir, so many remedies, and sir, we are confused. Can you give Staphylococcus aureus for a blow? Somebody comes with a blow. Somebody gets hit by somebody, and they come to you. Will you give him Staphylococcus aureus? What is the remedy you give there? Arnica. Somebody comes cutting. Will you give arnica? Or will you give calendula? Sir, granulation should increase. Or will you give symphytum? You getting my point? If you are clear here, then confusion is a word that should not be in your dictionary. What is confusion? What is confusion? Not being clear, no clarity. Fine? Should I marry him? Should I marry her? That is also confusion, Allah. Marry him or marry? So that can also be confusion. So confusion can happen at different levels. Okay. So here what confusion you see is, if you are clear with remedies, you will not be confused. Okay. So we will try to understand what type of injuries we have in Ledum. Ledum has what we call it as punctured. And before we take up Ledum, one more simple remedy we missed here was hypericum. Very good. What happens in hypericum? Nerve injuries. Which patient will come and tell you, uncle, auntie, give me hypericum, I got nerve injury? How will you get to know it is nerve injury? More than bites. Like for example, areas which are rich in nerve endings, which are rich with nerve supply. That's why hypericum becomes one top remedy for injury for spine. Which area you have more nerves? Allindanella nerves all will get, fine. So spinal cord. Spinal cord is one area wherein you have injuries to the spinal cord. There, the remedy that comes up is hypericum. And for example, your finger, accidentally you keep it in between the door and it gets slammed. And it gets crushed. There again the remedy is hypericum. Where you have more of nerve supply, there it is hypericum. Hypericum comes very close to Ledum. Punctured injuries. Now what do you understand by punctured injuries? Punctured. Okay, fine, good. One simple example your friend is giving me is lancet. Tailors. Good. Then rat bites. Good. Then stings of insects. Good. See, they all come under Ledum. Rat bite irbodu, insect stings irbodu, fine, or punctured injuries. For example, anything thorn, simple, mullu, okay, or a needle, okay, for example, or an injection. They are all different. They all come under Ledum. It's also a very good remedy for bites. Yeah, I know. I shouldn't have done this, but bites, many of the bites. Like for example, what are all the commonest bites that can happen? Dog bites, fine. Snake bites, insect bites. Insect we don't say bite, we say insect sting. For example, mosquito bite, bee sting, wasp stings. So wasp sting, okay, for example, mosquito bite, okay, or rat bite, dog bite, cat bite, cat, fine. Or like for example, poisonous animals, like for example, snake. Yeah, see, Scorpio also stings. See, though you have got better remedies for snake bite, Scorpio, sting, as a second year student you should remember Ledum. Simple, like for example, thorn, injury by a thorn. Thorn is what? Something that is sharp, something that is pricking. There we think of Ledum. Nail, accidentally you are walking barefoot and you have some sharp object that gets entered. Now what is the danger here? As a second year student, what is the danger? Jorage, tetanus. Yes or no? You have studied, no? Which is the organism? Correct, no? So chances of tetanus will be more. And Ledum is a remedy, when given, can prevent. For example, it's all infected, it's all rusted, and then that gets entered. And what will they do in allopathy? They give TT, tetanus toxide. So Ledum can be our homeopathic TT. Ledum can be our homeopathic TT to prevent. Once symptoms of tetanus have started, Ledum will not work. You getting my point? So Ledum, if there is a history of injury, a rusted thing, and then there is an injury, as a preventive, you can give Ledum. If symptoms have started, which is the remedy? Very good, hypericum. Hypericum is a remedy, absolutely right. When the symptoms of tetanus have started. Hypericum. You getting my point? All of you? So injuries, what did you understand? Mainly Ledum is indicated in punctured wounds. From sharp objects, punctured. See, anything which has to cause puncture should be sharp. Cycle puncture will not just happen like that. It should be something sharp. Fine? So sharp, punctured wounds is what you have in Ledum. Okay, then what else did you understand? Injuries. Yeah, stings, bites. Fine? Okay, we saw what all bites Ledum can be indicated. From dog, cat, mosquito. One of the top remedies for mosquito bites. Again, mosquito, no? Fine, again, it comes very close to punctured. You have the sharp pains. Done? And Ledum is a remedy which can be indicated. And the injured part. Now, you have to concentrate here. The speciality of Ledum, the injured part will be cold to touch. You getting my point? The injured part is cold to touch. Why in Ledum there is this coldness? Why in Ledum there is coldness? Ledum people will not have that vital heat. What we call it as animal heat, that vital heat, that will be missing in Ledum. And that's how the part to touch will be cold. Okay? The part to touch will be cold. Coldness due to lack of animal heat or vital heat. That is Ledum. But as rightly said, I heard somebody telling, the coldness, though it is cold, what happens in Ledum? They feel better by keeping it in cold water. Though it is cold, they feel better by keeping in cold water. That is special. That is characteristic. Okay? So even the injured parts look to touch, you feel that coldness. Other than coldness, see what generally happens in the injured area. Okay, more than swelling, killing, as a complication, you see the discoloration. That injured part is discolored. Now, when will you think of Ledum? In injuries or in discoloration? Discoloration which remains long. Should I repeat? What am I trying to tell you? Discoloration which remains long is Ledum. The only remedy you have in your Materia Medica. Few months back, there was an injury and that discoloration is still not gone. That is the situation where one can think of Ledum. So injuries which leaves discolor. I am not talking of scar. Scar is different. Okay? We are not talking of scar. We are talking of discoloration. Discoloration after injury, which remains long. Now, what are all the characteristic symptoms you have understood under injuries? First thing is type of injury. Type of injury is punctured. Second, how is the injured part to feel? Cold. Third, they're better by cold. And third thing is discoloration which remains long after injuries. Okay? Discoloration which remains long after injuries. That's the second point. Now third, you also see that Ledum is a remedy for hemorrhages. Though you don't see profuse bleeding, but see, for example, what happens when there is a prick? Do you see profuse bleeding? For example, somebody gave me the example of lancet or a thorn. You go pick up a rose flower to give to somebody and you get injured. So you got a small injury. Do you think this will bleed? No, very minimal. You don't see much of bleeding in Ledum. But it's a hemorrhagic remedy. Bleeding which mainly comes from nose, what we call this as epistaxis. The other remedy we discussed recently, More than dull camera. What was the cause in Sina? Boring. It is not exposure to cold. It is boring. Why do they bore? Irritation. Very good. So that was Sina. Here there is epistaxis. Dark bleeding from the nostrils. Okay. And then in women, you can see hemorrhoids, which bleed. Hemorrhoids are something else. Whatever I tell you, just keep listening. I am talking of fibroids. You tell whatever you want, fine. I was talking about fibroids which bleed. And the bleeding, if it was hemorrhoids, my hand should have gone somewhere else, no? What did I tell you? Hemorrhoids bleeding, and you're all, at least that thought didn't come. How can hemorrhoids happen here? Fine, so okay, don't worry. So we are talking of what? Fibroids. Fibroids which bleed. And the character of bleeding in Ledum will be dark. Another area where you can see bleeding in Ledum is hemoptysis. What is hemoptysis? Okay, in sputum you have blood. Blood is sputum. Hemoptysis alternates with rheumatism. And another area where you have bleeding in Ledum is the eyes. Okay. We have plenty of remedies which has bleeding, hemorrhages in the eye. In Ledum, hemorrhages in the anterior chamber. You understand? Posterior chamber, anterior chamber. In anterior chamber, you will have hemorrhage after iridectomy. What is this? So there is a procedure wherein, for some reason, let's not go into the details. For some reason, iris has to be operated, removed. So that is what we call it as iridectomy. So after that procedure, if you are bleeding in anterior chamber of the eye, the only remedy you have in your materia medica is Ledum. You got plenty of remedies which will have retinal hemorrhages, which will have bleeding in the eye. But the situation I gave you, what was the situation? Hemorrhages after iridectomy in anterior chamber. The remedy is Ledum. Clear? So hemorrhages can happen in the eye, it can happen in the nostrils, it can happen in the lungs, or in women it can happen in the uterus. Like mainly the fibroid, which will cause the dark hemorrhages. Okay. In eye, another very important symptom which is associated with joints, gout with cataract. What is the combination you have in Ledum? Yenadu? With gout, they will have cataract. Okay? Artha agtidea? Gout is cataract andre eno? Opacity, not inflammation. Opacity of the lens. Opacity is plus gout is there. Ideradu iddaga you can think of Ledum. So you have that combination of cataract and gout. Okay? Cataract, other remedies. Did we discuss? Cataract quickly, other remedies. Can euphrasia cause cataract? I don't know, it might be there in books, but generally euphrasia is not that deep acting. See, similarly, whenever we talk of eye, what comes? Euphrasia. Whenever we talk of injuries, we talk of arnica. I want you people to grow beyond. Euphrasia is a very simple remedy. What is the action of euphrasia in eye? What is the action? Inflammation. You are a pathology student. Fine? The main action is inflammation. You don't see growth, teeth and all in euphrasia. It's a very simple remedy. It will cause inflammation, it will cause acrid lacrimation. You don't see blindness, you will not see cataract, you will not see tumors, because it's a simple remedy. It's a psoric remedy. It's a very simple remedy. So anytime we talk of eyes, please don't disturb euphrasia for everything. Fine? Euphrasia. Okay? Artha agta idea? Now that's what we want you to grow a little beyond. Don't be like the normal homeopaths. Don't grow like a normal homeopath. Think. Now let me complete. Okay. Will symphytum cause, it's our turn. Will symphytum cause cataract? What will happen? What is the eye related problem in symphytum? Okay. Blow. Yeah, very good. Aditi, you said a word, beautiful word. Symphytum is the orbit. Why orbit? You are getting my point? So in symphytum it is the orbit, it is not the eye per se that gets affected. This is the kind of clarity you should have. Tomorrow practice will become very easy. Otherwise for some problem, some medicine you will give, and what will you tell? Homeopathy mein dam nahi. Matlab, it didn't work. Why it didn't work? Why it didn't work? It was not the right remedy, no? For some problem, for fibroids you give something else. And then how will it work? No, seriously, no. I mean, I don't mind if you're laughing, but then this is the reality. And in the end, we all end up blaming homeopathy. And homeopathy will never fail if you are right. Done? So we'll get back. So every time tomorrow, please don't use euphrasia. At least in my class, please don't use euphrasia. Okay? Because you should know the gravity. What will euphrasia do? What will euphrasia cause? Now what we are trying to tell you is cataract with gout. This is euphrasia. So this is Ledum Characteristics. Okay? This is Ledum Characteristics. See, anything we talk about eye, we talk about euphrasia, is music for you. So Ledum, cataract with joint affections. Cataract with more specific gout. See, joints can be too big area. We are talking of gout in specific. Cataract with gout is Ledum. Okay. So what are all the areas we have tried to understand here? First area we spoke was? Now what did you understand in joints? Gout, small joints affinity. What are all the complaints associated with rheumatism in Ledum? Listen to the question. What are all the complaints? Hemorrhages alternates with rheumatism or cataract associated with gout. Yeah, then it is ascending type. Diagonal affections, very good. And they are, when are they aggravated? Warmth of bed. You listen this carefully. Warmth of bed. Bed generates some amount of heat. So this heat, this warmth can aggravate joint affections in Ledum. So joint complaints, aggravation night. Joint complaints, aggravated warmth of bed. Joint complaints aggravated by movement. Yes, Ledum. Joint complaints ameliorated by cold application. Joint complaints ameliorated by cold application. Okay? Yes, Ledum. And injuries quickly. Small recap. Very good. See, now I hope you are getting a clarity. Again, injuries does not mean only arnica. Before you say arnica, you ask now what type of injury. Fine? If it is punctured, if it is cut, if it is blow, fine? If it is some injury to the deep organs, soft organs, injury to the bone, the remedies will change. And in Ledum, you have mainly punctured, very good, punctured wounds. Fine? Punctured wounds. And the injured part is cold to touch, and there is discoloration which remains long after injury. Good. Then what else? And for example, that eye complaints we spoke of, even that can be put under injuries. Okay. Not only that eye, under skin, you also have a lot of other complaints in Ledum. You will have carbuncles. Under skin, you will have carbuncles. What are carbuncles? Boils. Very good. More than boils. Cluster. The cluster of boils. Not a single boil. The cluster. What is a cluster? Group. So group of boils which will be there in the subcutaneous tissue. You have seen Kadwa Chauth, no? Not seen Kadwa Chauth, but then you should have seen this scene in the movie wherein the heroine sees moon through sieve. Why I brought this Kadwa Chauth scene here is carbuncle, you will have sieve-like appearance. Okay? You getting my point? Huh? Sieve-like appearance. Fine? And you will have pus pockets inside. Fine? And homeopathy, you have got good remedies. Though for an allopathy it's surgery. Fine, but homeopathy you can offer a lot of remedies. And one remedy is Ledum. One remedy is Ledum. Any other remedy you would like to contribute? Huh? Hepar. See again, whenever pus comes, hepar will come. Good, I am happy. Done. Good. More than hepar. I will talk to you about another remedy next class, that is Silicea. Now you will be more confused. When to use hepar, when to use Silicea. I will clarify it in the next class. Silicea, arsenicum alp, anthraxinum, lot of remedies for carbuncle. I should also tell you another very important symptom here, that is eruptions in Ledum will be on covered parts. You know? Eruptions on covered parts. So the part which is uncovered, there will be no eruptions. Parts which are covered, those parts, okay, you will have eruptions. One more remedy is, the only other remedy you have is Tuja. What is this I am trying to talk? Eruptions? Eruptions on covered parts. Fine? So the other remedy is Tuja. Okay? See, when I talk of eruptions, one more area where you can have eruptions in Ledum is mainly over the forehead. What can happen over forehead? Acne, pimples. Pimples over forehead. Okay? And especially in brandy drinkers. Now we will stop looking at each other's face. When I said pimples on forehead, you were all looking at friends having pimples. But everybody you can't give Ledum. Fine? In Ledum it is in people who drink brandy and they having eruptions, acne over forehead. That is Ledum. Other remedies for acne? Bellis? Where in bellis? Bellis. Yellow bellis. Acne? More than bellis. Yeah, again hepar. Good, no issues, hepar. Huh? Berberis vulgaris. Yes? Berberis vulgaris, what does it has? Stones. Renal calculi. And the remedy for acne is Berberis aquifolium. Good. Berberis aquifolium. Hepar. Hemamelis. At least from my knowledge. You have another remedy called Bovista. I don't know, must be confused it for Bovista. Bovista is lena aata hai? Agide Bovista? In Bovista, anyway, I don't know. If in Bovista it is in people who use a lot of cosmetics. Acne after cosmetics. Acne after cosmetics is Bovista. Or acne from cosmetics is Bovista. Bovista. Okay? So, illi irate Ledum alli acne? Acne or forehead. Acne in arnica. I will never ask you injuries in arnica. Other than injuries, I will ask you everything in arnica. Acne in arnica? Very good. Cheeks. Anything? Very good. Beautiful. Correct. Very good. मेरा तरफ से भी और एक जोर से मानना. Acne in arnica. Something else you would like to add? Yeah, she said cheeks. Good. Don't tell me different parts of the face. I am not asking you parts of the face. What is the speciality of acne in arnica? Good. Cheeks. Somebody. First. In arnica, you will have symmetrical distribution. She was using the word cheeks, absolutely right. So for example, if you have 4 over left cheek, you have similar 4 in the right, on the right cheek. similar type. Fine. Artistic. 4 here, similar areas you have 4. Symmetrical, bilaterally symmetrical means bilaterally it is same. So arnica has similar acne or similar eruptions, more acne in arnica. Okay? Clear? So we'll come back. Forehead alli forehead alli you have in ledum. Calcarea fossa is over. Calcarea fossa acne. Beka will continue. How is it in calcarea fossa? Calcarea fossa, what is very important for you in calcarea fossa is acne in girls during puberty. Acne again in calcarea fossa will be on forehead. But during puberty in girls who grow too tall. I had a case of a girl, okay, who had acne over her face. And generally in that puberty you have that spurt, they grow. So calcarea fossa, kids are too tall for their age.